everyone, good evening, good afternoon, or good morning, depending on where you are. My name is Darwin Chimba. I'm a final year medical student at Copperbelt University School of Medicine in Zambia, and I'm the president of the Association of East African Neurosurgeons. So today we are so glad to be here to have this wonderful meeting, which is the second, if not third, in this year, 2020, which is going to be a great year. We are looking forward to so many opportunities, so many great things that are going to be happening here at in AFAN. So before we go into the presentation, by the way, we are doing a clinical neuroanatomy. So today we have a presentation. So before we get into the presentation, I'm going to start calling everyone on the panel to introduce themselves, and then the presenter is going to introduce herself later on and begin the presentation. So first on my list, we have Dr. Anthony. Please introduce yourself.
Hello, everyone. Good evening. I'm Anthony Kwibwin, medical doctor, Lagos, Nigeria, general secretary and research fellow at AFAN. Very happy to be here. Thank you.
Thank you so much, Dr. Anthony. We're happy to have you. Then we have Ben Ojakapeli. Please, you can introduce yourself.
Hello, everyone. My name is Ben Ojakapeli. I'm a medical student from Moi University. I'm in 5th year. I'm glad to be here.
Thank you so much, Ben. We are happy to have you. Christopher Banda.
Hi, everyone. My name is Christopher Banda from the Copperbelt University, Zambia. I'm in 4th year.
Thank you, Christopher. Dr. Damilola.
Yeah, my name is Dami. I'm a medical doctor from Lagos, Nigeria, currently in general surgery. I'm a member of AFAN.
Thank you so much, Dr. Damilola. We are happy to have you here. And please enjoy the presentation as well. Then we have Dr. Ferro. Hope I pronounced correctly.
Yes, it is Ferro.
Okay.
Good evening, everyone. My name is Benu Ferrol. I'm medical doctor, and I'm in 1st year of neurosurgery residency in Dhaka. Thank you.
Thank you so much, Dr. Ferro. We are happy to have you, and it's good that we have a resident in our midst at this point. Next, we have Lauren. Please, you can introduce yourself.
Hello, everyone. My name is Lauren Sibabala, 4th year medical student from the University of Botswana, and also the Vice President of AFAN External Affairs. Thank you for having me.
Thank you, Lauren. It's always a pleasure to have you here. Then we have Musakanya.
Hello, everyone. My name is Musakanya Shturuka, a final year medical student from Zambia, and I'm also AFAN's country representative in Zambia. Thank you.
Thank you so much, Musakanya. We are happy to have you. Next, we have Nyauma Nelson.
Hello, everyone. My name is Nyauma Nelson. I'm a 4th year medical student from University of Rwanda.
Thank you so much, Nelson. Then we have Diami, Dr. Diami.
Hello, everyone. My name is Dr. Faktai Diami, medical doctor from Tanzania. Happy to be here.
We're happy to have you here, neighbor. We are glad to have you. Okay, then we have Dr. Shepard Matevo. This one should be from Botswana, I think. I'm guessing.
Yes.
Please introduce yourself.
Yes, hello.
Hi.
Yeah, my name is Shepard Matebe from Botswana, 4th year medical student in Eden University.
Thank you so much, Dr. Shepard. I know my neighbors. Okay, then we have Tabo. This one should also be from Botswana, I think.
Okay, hello everyone. Am I audible?
Yes, please, you are.
Oh, Okay, nice. I'm also from Botswana. I'm a third-year medical student in the University of Lusaka, Zambia. So I'm
Oh,
happy
you are
to be
here.
Yes, I'm around.
Okay,
Yeah.
that's nice.
Yeah.
That's nice.
Okay,
Okay.
thanks.
Then we have Victory. Please introduce yourself.
Good evening, everyone. My name is Victory Basifium. I'm a 400 level medical student from the University of Calabar, Nigeria.
Okay, we are happy to have you, Victory. It's really nice to see you here. Then we have Praise.
Yeah, evening everyone. I'm Wapus. Yes, I'm Wapus, a CK medical student from the Faculty of Health Science, University of Beira. I'm also the AFAN country representative for Cameroon. Thank you.
Awesome. Thank you so much for being here, Praise. Then lastly, but not the least, we have Dr. Winnie Kemei.
Hello, everyone. My name is Winnie Kemei. I'm a medical student at the University of Nairobi, Kenya. Thank you.
Wonderful. Nice having you here, Winnie. So it's I think it's my culture to always address everyone, especially those that I don't know, as doctor, because I don't want to misrepresent anyone. Okay, so unless maybe if I get to know you, I know maybe you're a colleague, you're a fellow, you're a medical student, then I'll be free enough to call you by your name without putting a title. Okay. So I think we can go into the presentation. At this time, I'm going to hand over to the presenter for today, which is Neontle. Please, you can go ahead. You can share your screen and introduce yourself as you begin the presentation. All the best.
Thank you, Darwin. Let me share my screen. Okay, so my name is Neontle Sakaiwa. I'm a fourth-year medical student from the University of Botswana School of Medicine, which is in Gaborone, Botswana. I'm also the AFAN country representative for Botswana, and I'm also part of the Department of Communication here in AFAN. So I'm really happy to be doing this. So thank you so much for having me and giving me this opportunity. And I'm aware that I'm in the midst of professionals, so this is also going to be a learning curve for me. So I'll just get started. So today I'll be giving you a presentation which should be based on the brain, the first part of a series of presentation that will be on the brain. So today we'll be focusing on the cerebrum. So to get started, I'll just share with you my plan. Like I said, I'll be giving you a talk on the cerebrum. So I'll start with the objectives and then introduce the brain and the cerebrum, and then go on to talk about the clinical and the surgical relevance. So the objectives for today are that at the end of this presentation, everyone should be able to identify the different parts of the brain, have a bit of knowledge on the embryology, the overall anatomy and functioning of the cerebrum, and also be able to take note of some features of pathologies that affect the cerebrum and surgical practice that is related to the cerebrum. So basically, the brain is a part of the central nervous system that is alongside the spinal cord. And averagely, an adult brain would weigh about 1.5 kilograms, and this can go as low as 1.2, it can go up to 1.3, and you'd find that there are usually differences between male and female brain sizes, with males usually having bigger brains, and it's approximately about 15 centimeters long. And its main function is just to control every process that happens in the body, and basically to regulate every process in the body that can go from thoughts to memory, breathing, temperature, and also motor skills as well. So it just controls the body. And then this is a snippet of the embryology. So when it comes to the embryology, you'd find that there's what we call the neural tube which is the precursor to the brain. And it usually, the anterior portion of that neural tube would form the first three parts that you see on the left, which are the primary brain vesicles. And these would be the prosencephalon, which is the forebrain, the mesencephalon, which is the midbrain, and the rhombencephalon, which is usually regarded as the hindbrain. And then with time, you'd find that these primary brain vesicles would give rise to other vesicles, which are secondary brain vesicles. And there's 5 of these. We have the telencephalon, which is the origin of the cerebrum, the diencephalon, which would form parts like the thalamus, the hypothalamus, and then the mesencephalon, which would lead to a formation of the midbrain. And then the rhombencephalon forms the metencephalon, which forms the pons and the cerebellum. And then the mencephalon would form the medulla oblongata. So the parts that you see on the far right are the parts of the brain, or the parts of an adult brain. So these are the parts that you see depicted on this next slide. So we can look at the animation and have a gross understanding of how the parts are supposed to look. And then when you look at the actual brain, it's hard to depict, but when you've seen the animation, you can actually take note. For example, you can see the cerebral cortex in much detail in the animation, and then take note of the actual anatomy. You can see the corpus callosum, the thalamus, and then take note of them on the real brain. You can also take note of the brainstem and the cerebellum right underneath the posterior part of the cerebrum. So that is just a snippet of what the brain is all about. And then when it comes to the cerebrum now, which is the main topic of today, you can also have a gross understanding of how it's supposed to look. So the cerebrum is basically the largest part of the brain. It's a part that's, like the previous slides have noted, it originates from the telencephalon, and also functions in various issues like speech, hearing, cognition, as well as emotion. So the cerebrum is basically located within the cranium. As you can see, it follows the curvature of the skull or the cranium, and it extends from the frontal bone and goes anteriorly and then goes posteriorly until you see it going through the curvature of the occipital bone. So this is the internal structure of the cerebrum. So if you look closely, you'd find that this is actually a frontal or coronal section, and it can show you that we have what we call the white matter here, and then we have what we call the gray matter here. So this is the outer portion. So the gray matter is usually at the surface of the cerebral hemispheres, and it's also associated with issues like processing, issues like cognition. And then the white matter is here, and it's usually consisting of the glial cells. It usually consists of axons, and then you can also take note of the differences in terms of color. The darker area is the gray matter, and then the lighter area is the white matter, because it has this myelin in it. It's myelinated. So this is more on the external anatomy of the cerebrum. So what you can take note of are the different surfaces of the cerebrum. So basically the cerebrum has about 3 surfaces. So these are the superior lateral surface that you can take note of here. You also have the medial and the inferior surface. So the medial surface is here, and then this is the inferior surface. And then it also has what we call borders. And then the borders, we also have about 3 borders. We have the superomedial border, and then we also have the inferior border, which consists of an inferior lateral and inferior medial component here. So as we continue, you can also take note of the poles of the cerebrum, of which it also contains 3 poles. We have the frontal pole here depicted in blue. We also have the green portion, which shows the temporal pole. and the occipital pole. And one thing you can note is that as we continue, from last week's lecture, we had a talk on the bones of the cranium, and then these ones we had the frontal bone, the temporal, and the occipital, as well as the parietal. So almost everything we're going to talk about in relation to the cerebrum is also going to be correlating with those bones. So the frontal pole is by the origin of the starting point of the frontal bone, the temporal pole as well as the occipital pole. So now we have the external structure of the cerebrum. So for the external structure, what we can take note of right now is that it's divided into two main hemispheres. That is the left portion and the right portion. So these are the left and the right hemisphere, the left and the right. And then what you can also note is that the left and the right are divided by a very long fissure, or a very long groove that is called the longitudinal fissure. They're also connected by what you know as the corpus callosum, which is just white matter, or a band of white matter fibers that also helps in communication between these two hemispheres. So if I go back to one of the slides, yes, this one, you can take note of the corpus callosum. It was not well defined in that slide. So, and then as we continue, we can also take note of the fact that the cerebrum consists of two main structures. There's what we call sulci, of which the singular is sulcus, and then gyri, of which the singular is gyrus. So sulci are actually the grooves or the fissures, something like this that you can see. And then the gyri are actually these convoluted figures, or these bumpy figures that you can see as denoted by the arrows. And one thing that you can do is to take note of certain important sulci and gyri. So for the sulci, you have to take note of the central sulcus, which is the one that separates the frontal and the parietal lobes, which we'll also mention in future. So this is the central sulcus. And then you can also take note of the lateral sulcus here, which is the one that separates the frontal and the parietal lobes from the temporal lobe. So this is the parietal, this is the frontal. So this is the lateral sulcus that separates the two from the temporal lobe, which is down there. And then the main gyri that you can actually take note of are the precentral, the postcentral, and the superior temporal gyri. So what's important is that the precentral, and the postcentral are named in relation to the central sulcus. So it's going to be easy for you to remember them. And it's important for you to remember them for later parts of the presentation. So as you can remember, this is the central sulcus. And then we have the precentral sulcus, which is anterior to the central sulcus, and then the postcentral gyrus, which is posterior to the central sulcus. And then we have what we call the superior temporal gyrus, which is down there. It's also right inferior to the lateral sulcus that we took note of in the previous slide. So again, we can also move on to the lobes of the cerebrum. And with the lobes of the cerebrum, we have about 4 main lobes. And then these ones are the frontal lobe, which is depicted there in blue, the parietal depicted in yellow. And then on the far back, we have the occipital lobe, which is posterior. And in green, there laterally, we have the temporal lobe. So this is an image of the actual brain. And unfortunately, we don't have the color coding here, but what we can do is try to remember the sulci that we talked about. So here, as we have our lateral sulcus, below it, you can take note of the temporal lobe, and then you can also take note of the central sulcus. So knowing that anterior to it, we have the frontal lobe, and posterior to it, we have the parietal lobe. And then there we have the occipital lobe. And yeah, they're dividing it with the parietal lobe. We have the parieto occipital sulcus. And then we can now go and talk about the different lobes in detail. So this is our frontal lobe, of which we can take note of its functions. It's usually involved in functions like higher intellect, personality, mood, social conduct, and language. And this language relating to the dominant hemisphere, which is something we'd also try to address as we move on with the slides. So in the frontal lobe, again, we would want to take note of the primary motor cortex, which is located right at the precentral gyrus. So that's why I said we have to make sure that we remember the different gyri and sulci that I talked about previously. So it basically, the primary motor cortex controls voluntary movement. And then we also have to make sure that we take note of what we call the Broca's area. This is in relation to the language function. It's they're located in the frontal lobe as well, and it's a speech area that is involved in speech production and articulation. So this one is also one of the areas that we'd find in the dominant hemisphere and will be addressed later. And then when talking about the parietal lobe, we find that it also has two paired lobes, and the two lobes would definitely have different functions as well, because this is also related to the issue of cerebral dominance that I'll talk about later. So the dominant one would be usually relating to language and calculation, and the non-dominant one will be usually relating to issues like spatial recognition and perception, and the ability to just perceive, analyze, and talk about visual patterns and images. So that is what the non-dominant hemisphere will be doing. And then it also is involved in issues like sensory perception and integration. And this is where we'd find the somatosensory cortex, the primary somatosensory cortex. And if you go back to the previous picture, you take note of the primary somatosensory cortex, which is located in the post-central gyrus that we mentioned earlier. So that is an important issue as well. And then the temporal lobe basically functions in issues such as memory, language, recognition, and language in the sense that it's where you'd find the vernix area, which is one of the language area that is involved in comprehension of speech. So basically understanding both spoken and written language. So this area is important, as you can find it in the most posterior portion of the superior temporal gyrus that we mentioned earlier. It's also the location of the primary auditory cortex. So this one is where you'd find reception of sound sensations, and also it's responsible for hearing. And then the occipital lobe basically is involved in it's the location of the primary visual cortex, and it's actually located quite posteriorly and in correspondence to the occipital bone. So this is what I talked about earlier, that you'd have to take note of the fact that every part is in correspondence to the bone that it sits under. The same thing goes for the lobes that I just mentioned previously. And then so basically, the issue of cerebral dominance is pretty much related to which hemisphere sort of controls what. That is all about lateralization of the functions. Some functions are controlled by the left side, some functions are controlled by the right side. But then when it comes to the dominant one, it's the one that usually controls the handedness, whether a person is left-handed or right-handed, where you find that most people have the right-handed. So the left hemisphere is the one that is most dominant. And one pattern that you can take note of this is the fact that there's contralateral dominance, in the sense that the left hemisphere is, if it's dominant, is controlling of the right side of the body. So this is because when fibers come from the cortex to the peripheral parts of the body, there's what we call decussation of fibers when they reach the medulla or the medullary pyramids. So the fibers kind of cross over to the other side. So fibers from the left hemisphere would cross over at the medulla to the right side, and hence there's control of the right side. So that is that when it comes to cerebral dominance. And then, yeah, so basically this is just a snippet of the blood supply, even though this is out of the scope of this lecture. So the supply to the cerebrum would be in 3 distinct paired arterial branches, where you'd find the anterior cerebral artery, the middle, and the posterior cerebral arteries. So basically, when it comes to these arteries, the anterior branch or the anterior cerebral artery is a branch of the internal carotid and supplies mostly the anterior medial portion of the cerebrum. The middle cerebral artery is rather a continuation instead of a branch of the internal carotid, and then it supplies mostly the lateral portions of the cerebrum. And then the posterior cerebral artery is a branch of the basilar artery and supplies both the medial and lateral portions of the posterior cerebrum. So also not being in the scope of this lecture is the venous drainage, where you'd find that it's usually provided by the dural venous sinuses, of which we have a superior and a deep system, and then they would all drain eventually into the internal jugular vein. So when it comes to clinical relevance, we have what we call, or rather in general, we have different clinical pathologies that would eventually lead to compromisation or would cause jeopardy to the functions of the different parts of the cerebral cortex. So one of these pathologies is the cerebral vascular accident or the stroke, where you find that generally it's involved in, or rather leads to a disturbance of the blood flow to the brain or to the different parts of the brain. Usually a certain section of the brain is affected at a time, and you'd find that a person who presents with features that relate to compromisation of that portion. So as you can see, we have an ischemic and a hemorrhagic stroke, and then we have a CT scan that depicts the bleed that happens or the infarct that comes as a result of this. And then we also have a brain abscess, where you'd find the sections of pus formation on different parts of the brain. It also leads to compromisation of the functions. And then we also have different types of tumors, brain tumors. So from the left side, you see the inferiorly a tumor has formed at the orbital part, and then on the right side you take note of the glioblastoma that is formed represented on that coronal section. Okay, so clinically you'd find if there's any compromise to the frontal lobe, you'd find with different parts presenting differently. The most common issues involve personality and behavioral changes. If you remember the story of a certain gentleman called Phineas Gage, who was a construction worker who had a mental rod run through his brain, run through his skull, and then when he came out, he actually survived. When he came out, he had a totally different personality that the people around him did not recognize him, and it was actually determined that the problem was related to damage to the frontal lobe. So that changes his personality and behavior. So that's one of the things you can look out for. Also, inability to solve problems and issues like that. But you can also take note of damage to the Broca's area, which is the area that is involved in speech production. So if there's damage to that area, the patients usually have problems with articulating themselves or just speaking. They are not fluent. They sometimes do not pronounce words and issues surrounding that. So it's something you can look out for. And then the parietal lobe, when its different parts are actually compromised, you take note of issues like attention deficits. One example is the contralateral hemispatial neglect syndrome, where you'd find that it usually affects the right side of the parietal or the right parietal lobe, where you find that the patient, when their right parietal lobe is affected, has a problem with paying attention to one side of the body. So if for example, there's a damage to the right side of the parietal lobe, the patient would definitely ignore the left side of their walls, including the left side of their body. So you find that maybe if they're given food, they'll eat on the right side of their plate only and then ignore the left side. If maybe it's a male patient and they're shaving, they would shave the right side and leave the left side. And if they're maybe washing up, they would wash the right side and leave the left side. So they would totally ignore the that is affected. So also take note of the contralateral nature of this. So it's really an interesting presentation, and it's something also to look out for. And the left side is usually less affected in this case as well. So yes, that is that. And then when it comes to the temporal lobe, mostly when it's affected, we can take note of recognition deficits, that is agnosias. So this is where you find a patient is unable to like identify or recognize certain objects or certain people or certain sounds. And this would not be explained by any memory deficits or language or just being unfamiliar with something. It's something that they're previously familiar with. So sometimes patients can present with that. And with the occipital lobe, because it's where the primary visual cortex is, sometimes it presents with visual field defects. And that is just as straightforward as that. Sometimes they have trouble driving, they have blurred vision, sometimes they just walk into objects and issues like that. So, okay, I forgot to mention also in relation to these areas, if there's damage to the speech area known as the vernix area, patients would have problems with understanding. They would be able to talk, but they would have problems with understanding speech or understanding writing when they're given written language. So surgically, there are basically different surgical procedures that are done on the brain, going from surgical procedures like craniotomies, where you'd find that a piece of the skull is removed in order to access the brain, usually to remove tumors, to decompress, and issues surrounding that. And then we can also take note of issues like biopsies that are usually done through maybe needle incisions to take fluid, to take cells or tissues in order to examine them, usually to be examined by pathologists. We also have neuroendoscopy, even though it's not depicted in the slide, where you find that there's access to the nose or the mouth, but it's without cutting the skull. And it's usually said to be minimally invasive. We have issues like laser ablation and stuff. So when it comes to these surgeries, it's sometimes they present a risk like infection, risk like bleeding, and also formation of clots. And sometimes long-term risks like behavioral changes and speech problems, memory losses, or limb weaknesses that are also related to damages to the important areas of the cortex. So those are some things that you can also look out for. So these are my references, and thank you so much for your attention. I apologize for the technical problems. So thank you so much.
Right, thank you so much, Neontle, for this presentation. I don't know, but I think, is this your first presentation?
Yes, it is.
Okay, so you did it so well. You did it so well as if it wasn't your first presentation. I remember myself, my first presentation, I wasn't this clear. I wasn't so much on point as you were. It's so impressive. Like it's so impressive. So at this point, I'm going to first open it up to the seniors. I can see Dr. Noru. There are also other, I think Dr. Ferro. Yeah, so the seniors that are here, please, if you have any questions for Neontle, you can go ahead and ask. And then the medical students, you can also ask after that. Please, if you have any questions, you can go ahead and ask. Dr. Naru, any questions for Neontle?
No, I do not have a question especially. I can, if our colleagues have a question, I will be there to answer. And I just want to congratulate Neontle for this beautiful presentation. It is clear he give, she reached out the essential. So yeah, I am congratulate her on her nice job. Yeah, congratulate Neontle. It is it's not easy to have all things in your presentation because it is very complex, you know, but you did well. You reach out the essential point that we should keep in mind, and that is great. But we can also discuss about some feature if people have. Thank you.
Thank you, Dr. Naru. Dr. Ferro, do you have any question?
No, I didn't have question. I think that I am agree with Dr. Nondin. I want to congratulate her for this presentation because it is very clear and that helped to see the main thing that you must retain about the brain. So I think that it is a very good presentation for the first time. And with time, if they have something to add, we will add it. But for now, I didn't have some question. I just suggest to her in the next time to present the ventricular system in the brain, because I think that is an important part of brain also. But apart it, I didn't have no question, and I just want to congratulate her for this presentation. Thank you.
Thank you so much, Dr. Ferro, for that comment. I'm sure you're taking note. Any other question? Medical students, especially this topic is especially for medical students. Please, if you have any question, any clarification that you'd want to be made, please go ahead and ask. I remember Dr. Kabulo would always hammer a question, and then you're just like, does this man know that I'm a medical student? Okay, so if you have any question, you can please ask so that it's clarified. Anyone? Anyone with a question? Okay, so it seems everyone is okay, everyone is clear, and we're so happy that you presented this topic, Neontle. It was so amazing following through, and it was so clear. Thank you so much for taking your time to make this presentation. It was really amazing, like I've already said, especially that it was also your first time. It's really commendable. So please keep it up, and thank you so much for presenting today. So we are going to end here today, and hope to see you everyone next time, or rather next week. Please have a wonderful night.